So you arrive at the hospital on the 23rd at about midday. You don't see a doctor until the 26th at about 9 o'clock, and you have severe COVID infection. So by that time, because his kidney functions had not been attended to, in fact, they didn't even know that, the doctors that were looking after him. They didn't assess his chest x-rays. They have never seen them until we were interviewing them.
The Health Ombud, describing the appalling state of affairs at Tembisa Tertiary Hospital, which led to the death of Shonisani Lethole in June last year, following his admission to the hospital with breathing difficulties.
The medical care that was rendered to Mr. Lethole was categorized as substandard by almost every witness that we interviewed. But it had lots of elements of medical negligence that were found by the Health Ombud. Mr. Lethole's mortality was both avoidable and preventable because he was a young man at 34 with no comorbidities.
Before his passing, Lethole reached out to the Health Minister Dr. Zweli Mkhize via social media. He claimed that he was starved and treated poorly. The Health Ombud has now confirmed this.
On the food, if you want to remember one thing, it's this. Mr. Lethole was not offered food at Tembisa Hospital for 100 hours and 54 minutes.
The hospital record keeping was described as poor. They also offered inaccurate information during the investigation. The Health Ombud also revealed that only one person showed remorse for the loss of life during the investigation.
They were saying to the Ombud, you know, look at it from our angle, try and save our skins as professionals. And they never even spoke about Shonisani. That, to me, was a shock.
Lethole's parents feel vindicated by the report, but they are still hurting.
I knew that he was telling the truth even before, because the way we raised him to tell the truth, not to fear anything. That is why he did that. So even though it's hurtful, but we reach a level of saying if it will improve other people's lives, we will feel better about that.
The Health Ombudsman recommended that 19 staff members face a disciplinary action. Meanwhile, the Gauteng Department of Health said it would study the 200-plus page report. Sipho Sturman, SABC News in Pretoria.